Hello, welcome to all. My name is Nimi Joseph. I am an RN. I will be presenting prostatic disorders today. There are mainly three types of prostatic disorders. Benign prostatic hyperplasia, that is BPH, prostatitis, and prostate cancer. We will also discuss today about erectile dysfunction. Functions of the prostate. The prostate is a walnut-sized gland located behind the base of the penis, in front of the rectum and below the bladder. It surrounds the urethra, the tube-like channel that carries urine and semen through the penis. The primary function of the prostate is to produce seminal fluid, the liquid in semen that protects, supports, and helps transport sperm. In this picture, you can see the prostate that is normal in size and the urethra is normal. First, we will talk about benign prostatic hyperplasia. It is an enlargement of the prostate and the cause is unknown. You can see a normal prostate and an enlarged prostate in this second picture. So the right hand side of the picture, the urethra is narrowed, so the urine from the bladder, it is very difficult to go through. Causes of BPH. Non-cancerous condition of unknown cause. BPH occurs in 70% to 80% of old men as they reach their 70s and 80s. Prostate enlarges from about 20 gram average size among young and healthy men to as large as 150 gram. Pathophysiology. The pathophysiology of bladder outlet obstruction in men with BPH has been attributed to both static and dynamic factors. Static obstruction is due to the bulk enlargement of the prostate encroaching upon the prostatic urethra and bladder outlet. Dynamic obstruction is related to the tension of prostate smooth muscle, mainly due to hyperplastic. That means increase in the number of cells, not hypertrophic. Hypertrophic is the increase in the cell sizes. So in BPH, increase the number of cells occurs. Treatment. The first line treatment is medication to reduce prostate size and to relax prostate muscle. And doctors may also perform surgery, cutting away the excess growth. We will talk about prostatitis now. It is an inflammation of the prostate. And in this picture, you can see the enlarged prostate. The causes of prostatitis is non-bacterial and bacterial. Non-bacterial causes are spasm, that is tremor or prostate muscles, viruses, stress, backflow of the urine. Bacterial prostatitis is mainly due to sexual transmission. The symptoms are painful urination and ejaculation, urinary frequency, urinary urgency, pain in the perineum, groin, genitals, and lower back, and you will also notice blood in the urine. Pathophysiology. In bacterial prostatitis, sexual transmission of bacteria is common. The presence of acute inflammatory cells in the glandular epithelium and lumens of the prostate. With chronic inflammatory cells in the periglandular tissue characterizes prostatitis. So in this case, the prostatic tissue compresses the urethra and due to overgrowth of normal cell. Treatment. It can be treated with antibiotic such as Levaquin and Bactrim. The doctor may also prescribe pain medications and medications to relax prostate muscles. And warm 6 bath also will help to reduce inflammation and pain. The last one is the prostate cancer. It is the cancer of the prostate. The cause is unknown. Aging is a major risk factor. And in this picture you can see the malignant prostate. It is spreading to other organs too. Best to catch early. Prostate specific antigen testing and digital rectal exam. In your yearly screening, the doctor will perform a PSA test. It's a blood work to check your PSA levels, and digital rectal exam will help to understand the doctor to the size of the prostate, and they will be able to give you treatment accordingly. Symptoms of prostate cancer: difficulty starting urination or holding back urine, weak or interrupted flow of urine, difficulty in having an erection, painful ejaculation, blood in urine, frequent pain or stiffness in the lower back, hips, or upper thighs. Treatment: the prostate cancer can be treated with hormones, chemotherapy, radiation, and surgery depending on the stage of the cancer. In chemotherapy, medicine can be given orally or by injection. And in radiation, the surgeons implant transmitters into the prostate, and X-ray plate is placed over the body to deliver radiotherapy, and signals ensure radiation hits the target that will help to kill the malignant cells. And the surgery, the doctors may cut away the malignant part. Now we are going to talk about erectile dysfunction. That is also called as ED. ED dysfunction is the consistent inability to attain or maintain a sufficiently rigid penile erection for sexual performance. 50% of men experience ED between age 40 and 70. Most causes of ED are treatable. Example: hormonal problems, medications, pelvic or genital injury. The pathophysiology of ED depend on the cause. If it is nerve damage from long-standing diabetic neuropathy, cardiovascular disorders affecting the blood supply to the pelvis, certain prescription medications, operation for cancer of the prostate, fractures that injure the spinal cord, multiple sclerosis, hormonal disorders, alcoholism, and other forms of drug abuse. Treatment of ED and hardness problem. The first line therapy is oral medications such as Viagra, Levitra, or Cialis. And while we are using PDE5 inhibitor, it should be used 1 hour before sex. Empty stomach is the better, and otherwise 2 hours after meal. Requires sexual stimulation. During the nitrate therapy or heart disease or stroke, don't use PDE5 inhibitors. Maximum 1 dose per day. While diagnosing ED is important, ED screening may signal underlying diseases such as diabetes, hypertension, dyslipidemia, and coronary artery disease, and depression. ED can also result in anxiety, decreased self-esteem, reduced quality of life, negative effect on relationships. Treatment effectiveness. After the prostatitis treatment, the doctor will obtain the culture, and if the culture is negative, after the antibiotic course, that means the prostatitis is resolved and the patient is cured. In BPH, after the treatment, urination without having to exert force, that means the BPH is cured and it is resolved. Depending on the stages of cancer, prostate cancer, in first and second stage, it may heal with minimum treatment, but third and fourth stage, they may need prolonging treatment and follow up with the doctor. ED, after the treatment, return to normal ability, that means the treatment is working well. Patient education. Always take your medications as directed and prescribed by your doctor. Follow up with your doctor as scheduled. Undergo all screenings recommended for your age. Always maintain good hygiene. Keep active and maintain a healthy weight. Avoid unhealthy behaviors such as smoking and excessive alcohol. Avoid wearing tight underpants and underwears. Try to use cotton underpants. Eat fruits and vegetables. Drink plenty of water. Avoid fatty diet. And patients, those who are undergoing prostate cancer treatments such as chemotherapy and radiation, you may experience nausea, vomiting, constipation, hair loss. Talk to your doctor and they may be able to help you with that. And you have any questions, you are welcome to ask now.